Of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
And joining us live in studio is Dr. Mark Hitt, Executive Medical Director of Regence Blue Cross Blue Shield of Utah. Where do we begin when we talk about the potential damage to your eyes from looking at the eclipse, Doctor?
Well, the damage, Amanda, is called solar retinopathy. It's also known as photic retinopathy or solar retinitis. It's a very real damage or injury that can occur to the retina, which are at the back of your eyes.
Okay, a lot of people have these either paper glasses or the ones you brought into studio today, these hard plastic glasses. So talk to me about glasses. What are we talking about here?
Well, it's really important, Brian, to wear glasses with the proper filters.
Mm-hmm.
And a lot of people have been subject to these misrepresentations. In fact, a lot of people have had their money refunded from Amazon, as I have, for glasses that don't have the proper filters. You see, it's important to filter out a part of the spectrum of the sun's light called the infrared, because that can damage your eyes, and only special glasses with special filters can do so.
You brought me some of these glasses that are the good glasses, and I can't see a thing with these. I mean, these are the darkest glasses I've ever put on in my life.
And these are the ones that were refunded, right? These
That's
hard
right.
plastic ones these aren't the good ones then.
And here in the studio, it's black. They completely block out the light. They're 100,000 times darker than your typical sunglasses, but that's not enough.
So our eyes don't have the pain sensors in the back.
That's right.
So you could be looking at something that looks pretty relatively easy on your eyes, and your eyes aren't screaming to you going, hey, what are you doing? Stop this.
That's exactly right. That's the scary thing. You won't feel and you won't see this near-infrared radiation, which would damage your eyes. So that's why it's important to have that filter.
How bad can the damage be?
Well, the damage could be pretty bad. It can cause symptoms that may persist for several months, and in some cases it can be permanent.
Can you look at, I'm sorry, Brian, can you look at it just for a second? I mean, could you just go boom, and then look away and have it be okay?
Well, it's going to be like looking at the sun at any time, eclipse or not, which is bad for your eyes.
Yeah.
It may not lead to blindness, but I say why risk it?
Always have that little dark spot that at least lasts, like you were saying, for minutes or hours, possibly, something like that. So just take it easy out there. Make sure you have the approved glasses, of course, if you're going to be looking up at the sun. I think
especially for kids.
Oh, for sure, yeah.
And here's one tip, Brian and Amanda, is that when you put them on, don't be looking at the sun. Look at the ground, and then look up with the glasses on to fully protect your eyes.
Okay.
Oh, thank you, Dr.
There you go.
I always learn so much. This portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.